We are back with our very special guests. They've been here before, individually. Now here they are together. And I should make a point of noting that this is not related to the fact that support for WHUP comes from both Hillsborough Pharmacy and IndyCare. But we have from Hillsborough Pharmacy, Tiffany Graham-Barber, and from IndyCare, Franklin Roy. And they're here to talk about this really fascinating new initiative that they have boldly titled ScrewUFlu. Good morning, Franklin and Tiffany. How are you guys doing?
Good morning.
Good morning, Bob. Doing great.
Good to see you. You mentioned this in passing on the street, Franklin, a few weeks back, and thought, wow, that's really interesting and different and innovative. And let's get you guys on to talk about this. So first of all, it requires a partnership because both of you are bringing a piece of this initiative to the table. But let's start off with what is ScrewUFlu? Take it away, somebody.
Okay, well, ScrewUFlu is our attempt to stop the spread of flu by treating people who have the flu at their home and preventing them from having to go out and get treatment, get medications, and potentially spread their influenza virus around in the process of doing that.
Yes. Well, in fact, we all know people come into work and they've got flu-like symptoms. They have not been diagnosed. And the next thing you know, the entire office or studio team has come down with it. And so you're going to try and nip that in the bud. Now, I guess first you have to diagnose it. Is that right?
That's right.
That's correct.
So how do you go about doing this? Someone calls you and says, I need ScrewUFlu to come to me and let's figure this out. So how does this work?
Yeah, so the first step would be a virtual visit with one of the medical providers at IndyCare. So we have virtual telemedicine appointments available that people can schedule on their own time. And it's very simple for any computer, any phone, any tablet. You can connect visually with the medical provider at the IndyCare clinic. So they will go through a process of taking your history, evaluating your symptoms, probably talking you through a little bit of a self-examination for them to make an assessment of how likely it is that what you're suffering from is the flu or not.
Okay. And then if it is determined that maybe, because we can't tell without a test, they have the flu, what happens next?
So then we hand it over to the team at the Hillsborough Pharmacy who take care of kind of that last mile of care, if you will. And they go into the home and perform the rapid flu test at the patient's home and can confirm or rule out flu infection. And they're sent to the home with instructions from the medical provider about what to do with that patient and different options of what medications and treatments to provide them based on the results of that test at their home.
So the test comes back negative for the flu, but they have other symptoms. You have a little kit to give them that helps them treat those symptoms, whether it's some kind of bronchial infection or severe cold or whatever it is. You've got a little array of options there for them. If it is the flu, there's Theraflu. Is that what you pretty much give them, or are there other options these days?
Well, Theraflu is an over-the-counter product, which is basically just symptom relief. But for treatment, is Tamiflu is what we usually use.
Oh, that's, yes, Tamiflu. Yeah.
And it's come out generic, so, you know, we know that you are the most contagious within the first 48 hours, and you are also the most likely to do well or get better faster if you have your medicine within the first 48 hours. So that has us to be able to, you stay at home, don't get anybody sick at the office, or if you are going to a doctor to see if you had the flu, then if you're going to the pharmacy to get the treatment, you're exposing yourself to all these different people. You get to stay at home, rest in bed, come to you, get you tested. If you do have the flu, you would have, of course, a treatment pack of a Tamiflu. If you don't have the flu, you would get over-the-counter products to be able to treat your symptoms and get you better faster.
And you still may have a communicable disease, even if it's not the flu, as most of us know at this time of year. Everybody's got something, the crud, as we like to call it generically, but not necessarily the flu. If someone is not able to access you virtually, is maybe on the wrong side of the digital divide, can they call you? And is there some way of trying to talk them through the initial screening?
It's possible. It's not as good, obviously, because we'd like our providers to be able to look at the patient, even look down their throat at some level, assess, swollen lymph nodes, and to visually check them. So if you're just doing it via telephone, it's primarily a history that you're getting, and it's not as good. But again, we do have the ability to confirm or rule out with the test at home, so it's still possible.
And the test is a pretty quick turnaround kind of thing. You just go to the home and you have a little test kit. How does that work?
Yep, you have a kit that involves a nasal swab. So you would swab one of the nostrils and then put that in the kit, and the kit takes about 15 minutes to get.
15 minutes. Mm-hmm. And it's pretty, it's got a high degree of accuracy, one imagines.
It does. It can tell if you have no flu or you have flu A or B.
Oh, it tells you type. Mm-hmm. Oh, wow. Okay. Hey, I have a question. Did they guess right this year? Do we know?
We don't know yet.
Yeah,
it's too early because flu really hasn't hit. I mean, the earlier flu that was hit earlier had... that is in the shot, but most people, it's too early for them to have gotten the shot by that time. But we currently don't know because the flu really just hasn't hit hard enough.
Okay.
Yeah, right now it's in North Carolina. It's tracking about the same as it does every year. I think statewide you got about 1,500 or so influenza-like illness visits that are taking place weekly. Okay. But you really kind of start to know what type of flu season you're having around December, January, when it really peaks. Whether that peak looks like last year or 2 years ago when it was really, really bad in North Carolina, remains to be seen.
Okay. Now, if people have not gotten vaccinated, which is one of the things that you both do, is offer flu vaccines, and they call in. You go there. If they don't have the flu, you also bring a little vaccine with you. Is that something you would routinely do, or is that up to them to decide? So of course, it's up to them to decide.
Right. That's not part of the package currently. Usually, if you're feeling terrible, you don't really want to get the flu shot right then, just because it'd make you feel even worse as your body builds up immunity to it. So it's not part of it, but they can definitely come in after they start feeling better and get it. We usually offer the flu shot all the way up through whenever we run out. Okay.
Now, how will you disseminate the word about this? Because this is a brand new thing. I'm sure you have some literature at both IndyCare and Hillsborough Pharmacy for people who are coming in, and you can tell them about that. But other than this radio program, which is perhaps the most efficient way to disseminate all the information to the community, how will you be spreading the word? Because it does depend in some part on people knowing about it.
So there's a few ways. We do advertise in the local newspaper as well. We advertise at the Sportsplex locally. And, fortunately, we have access through the pharmacy to probably, a couple hundred or 1,000 people a month that are coming to get prescriptions and lots of things that we can directly talk to about the initiative and make sure that they're aware about this for them and their families. One thing to keep in mind is it's not available to everyone, right? So most people, we try to we limit it to age 14 through 65. And that's just because the younger patients with flu-like illness or, more senior aged people with flu-like illness have a different risk profile, and we'd like to see them in person in the clinic and do a full examination.
Now, a lot of people, because of all the noise about the flu and our general fear-based culture, think they have the flu and don't. That is quite common, especially because there are flu-like symptoms that are a host of different illnesses. Have you rolled this out, and are you seeing the percentage at this point? Is this program currently underway, and is it about to start?
So it's about to start. We're actually going to launch it next week. Will be the official kickoff of this in terms of turning on the virtual visits and the full process. So it remains to be seen at this time, but we are starting just in general inside of the clinic to see a slight uptick in people presenting with flu-like symptoms, or they might think they have strep throat, pneumonia, bronchitis.
And how many flu cases have you actually diagnosed at this point in your respective establishments?
We haven't had a case of confirmed flu.
Not yet.
No.
Wow.
Not yet.
Yeah. A lot of people think they have it. So I'm wondering, this is a great thing. And it does have the double benefit of, even if it's not the flu, because more people can disseminate the non-flu bugs than the flu bugs, because just there are more of them. So it's useful in that respect also. But how will you assess this and adjust based on the percentage of people who are actually who actually have the flu versus people who don't?
Yeah. So if you look at the guidelines for treating flu, you have a couple different options. So usually, if the history and the exam tells you that it's a very, very high likelihood of this illness being the flu, for example, they may have known exposure to someone else who had the flu, then there is the recommendation to treat empirically, and you can treat someone with Tamiflu even without confirming flu test on them, because there is a small rate of false negatives with the test. It's really kind of the level beneath that where could be flu, they may or may not have had some exposure, the symptoms are consistent, and you want to rule in or rule out with the test, and that's probably the majority of people will present in that way.
Right, that makes sense. Well, how far afield can you go with this? Because I'm sure you can't go all the way up to Cedar Grove, or you would have no employees left to work in the shops. But what is your range that you can go with this? So
it's in Hillsborough zip code. So 27278. If you have a Hillsborough address, then you can, it doesn't have to be town limits, but it does have to be Hillsborough. It can't be on Durham or Mebane side of Orange County.
That's pretty expansive. I mean, that's up where I am, 5 miles north off of Walnut Grove Church Road. That's a 27278 zip code. You'll come to me?
Yeah.
Well, if you can find it, that would be great.
We're already delivering out that way for the most part. A lot of people that can't get out, we do deliver anywhere into Hillsborough for free. So we're already out and about.
Delivering for free to people in remote parts of the county. That's an amazing service. So you anticipate, are you prepared for an influx of people needing this service? How can you prepare? It's kind of like a restaurant. You don't know how many people you've got. You've got to staff up appropriately. How can you manage this effectively, make sure you have the right number of people but not too many so you're taking a bath?
Exactly. That's what we've been evaluating and looking at and training, and we just don't know how many people we're going to get. We don't know how many people are actually going to need to have the flu test, or if it's going to be very empirically noted that they're just going to need the Tamiflu, so it's more of a delivery situation. We don't know how many people we'll get or how many times we would have to go out during the day. So it's definitely going to be a learning curve to begin with. We hope it's a lot of people because we would like them to stay home and not further spread anything to the community.
And so would all their colleagues. Yes. So would their colleagues. We see these people come in and we just go, oh, why did you come in? Why didn't you stay home? You should have stayed home. But
and Bob, the thing is, we actually, most of the resources in terms of human capital, staff, infrastructure to do this is already in place, right? Because that's one of the unique benefits of the IndyCare clinic and Hillsborough Pharmacy together. So they're already delivering out into the home, making those visits to people. So we're tapping into that capability that they already have. And then in the clinic, we're putting a patient who's got a virtual visit for flu right onto the calendar the same way as we would anyone else. So that our provider might go from seeing one patient in the clinic to the next person being on their computer to the next person back in the clinic and so forth. So we integrate it into the workflow and systems that we already have.
This is so interesting, and it's made possible only by virtue of the fact that you guys are partner businesses and collaborate, and so there's a synergy that's involved here. You wouldn't have to be side by side with the connecting space in the middle, but it certainly helps that you're both right there. Are you familiar with this being done anywhere else? How did you come up with this idea?
We're not familiar with it being done anywhere else because it's the arrangement we have is really rare, right? So you do have people can get telemedicine and virtual visits for the flu and a number of things, but they won't be able to get a flu test through that means, and they still will have to get the medication from some other place that they may have to go out to.
Right.
Or they may be able to get medication delivered, but they still have to go somewhere to see a physician and get a flu test. So we're the first that I'm aware of who have combined, the three pieces of the puzzle into one solution that goes out to someone's home: the provider visit, the test, and the medications.
Well, that's pretty amazing that we are doing this first here. And how did this idea originate and then come to fruition? Who came up with this with this plan?
Well, we came up with it together, but I think it was because, long term, it's also an opportunity for us to test an important concept. And that concept is, how can a pharmacy be involved more in the last mile of care and deliver medical services into patients' home? So that's a big area of need, because most people in healthcare, they may see a physician and get a treatment recommended to them, but most of healthcare happens while you're at home or while you're at work and everything after that treatment. And so getting the medications into the home, helping people to, be compliant with what's been recommended to them, and figuring out the reality of their day-to-day life and how that might impact what you're trying to do with their care is a big area that's untapped in healthcare. And we think that pharmacy has a role to play in that long term. So this is a good opportunity for us to test the concept of really delivering not just product, but service into patients' home as it relates to their health from the pharmacy.
That is just so cool. Breaking new ground right here in town. We are talking with we're talking with Franklin Roy and Tiffany Barber. Franklin Roy from IndyCare and Tiffany Graham Barber from Hillsborough Pharmacy. Now I got to ask, who came up with the name ScrewUFlu?
It's actually our business partner. He came up with that. We went through various different testing of something that could be catchy yet not too vulgar.
That's pretty edgy. It's still pretty edgy for a mainstream kind of.
He's from New
initiative.
Jersey, so what do you expect?
Yeah, it's from New Jersey. Yeah, you get what you get. But
I love it. Has anyone sort of raised an eyebrow or questioned its propriety?
I don't think so. I can't imagine that it would be. There's a couple of other urgent care type centers that are doing similar things with similar wording. But they are doing it just as a telemedicine visit, not
right.
with the whole package that we bring. And in addition to coming out and doing all those things, we also bring you the necessities for whatever cold, flu, whatever you have, which is hand sanitizer, tissues, and soup.
Soup?
Yep. All coming together for you.
Wow. I'm impressed, I've got to say. Anything else about this? So next week, meaning Monday, Veterans Day, or Tuesday, or you get a specific day, then people can start calling you up.
Yeah, so we'll start Monday next week. We do have the website for the program is www.ScrewUFlu.com, ScrewUFlu.com. And when you go on there, you'll be able to see exactly how the program works, book your telemedicine virtual visit directly, and initiate the whole process.
And that website will be linked through your own individual websites, I presume, IndyCareHealth.com and HillsboroughPharmacyNC.com.
That's correct.
Yeah, that's correct.
Correct. Wow. Well, I'm really going to be fascinated to see how it all works, and I would certainly take advantage of it if I was feeling like garbage. And I can. That's the surprising thing, I think, that you're willing to go that far afield. But let's hope that this actually is the start of something big.
I mean, I think it will be. I think our society as a whole is moving towards being busy and just getting tired of waiting and waiting rooms and all the germs that come through there, and just kind of want individualized care. And they already receive that when they come to Hillsborough Pharmacy or IndyCare. So we're just partnering this to keep them home when they need to be home.
Well, back to the future. I mean, this is the old days when the doc would come to you and check you out if you were laid up, and deliver the care right there in the home. And we've come full circle in some ways.
Yeah, exactly. Yes, it's all about our community at Hillsborough Pharmacy. We've we've been working with the school system and with the county department to make sure we're giving as many flu shots as we possibly can to keep them healthy. But for those who didn't get their flu shot or happen to get the flu despite getting the flu shot, here's your other option.
Well, thank you very much, Tiffany Graham-Barber from Hillsborough Pharmacy, Franklin Roy, IndyCare, and you can find them both, IndyCareHealth.com, HillsboroughPharmacyNC.com, and all the things that they do. IndyCare, of course, an affordable, community-oriented urgent care and walk-in clinic, open 7 days a week. Hillsborough Pharmacy, free prescription delivery, and now home visits, if you might have the flu, to home or office. But if you got the flu, don't go to the office.
Don't go to the office, no.
And they're in Boone Square, right just outside of downtown on South Churton Street. Thank you both for joining us. Good luck with this. Keep us posted. Let us know how it's going. If people are tapping in, and we'll keep trying to spread the word about it.
Thank you.
Thank you, Bob.